Hi, this is Dr. Frezza at the Chiropractic Injury Center. Today we're going to talk a little bit about my story. When I was in chiropractic school, I know you can't tell now from looking at me, but I used to lift weights quite a bit. It was back in the time when Arnold Schwarzenegger was all the rage, and I remember I used to do the Arnold split routine where I would work out in the morning, I would work out in the evening after chiropractic school. And what had happened was I had injured my shoulder and my collarbone. Here I'm right in the middle of chiropractic school, and it was really starting to get worse. It was actually starting to affect my ability to be a student, to learn how to adjust and how to take care of my fellow classmates. I was to the point where I thought that I may need to drop out of school, and I was considering maybe having surgery, those sorts of things. And then as fortune would have it, I was in the clinic, the school clinic, and one of the doctors was there. And I told him what was going on, and he said, it's really not a shoulder issue. I had multiple docs at the clinic trying to work on it. He said it has to do really with your collarbone. And he kind of went into the whole thing with me. I told him what my symptoms were. And he said, I think we can get this fixed for you, but it's going to probably take about 6 months. We're going to have to go in and we're going to have to do some concentrated adjusting. You're going to have to stop working out for about 6 months. And at that point, I was willing to do whatever he said. So I did. I stopped working out. I was going into the clinic anyhow to take care of patients, and he did. He started working on me, and it probably took about a good 3 months before I started to feel better consistently, and then I was back to lifting weights, at about the 6 month mark. But I was always real thankful to him about that. Not having to miss some semesters of school and have to go through surgery. So when all was said and done, I said, I want to volunteer myself at your office and just kind of work and learn a little bit. And that's where I learned how to treat collarbones and how to treat and fix a lot of shoulder conditions. Since then, I obviously graduated, been in practice for almost 20 years now. Lots of patients, lots of neck and shoulder issues. Some of the best things that I've seen, working on all the extremities. I had somebody who 2 docs told him he was going to need replacement surgery for his knees. So he came in and said, "Can you do anything about it?" I said, "Look, we can try. I know what I would do." So the moral of that story is he finished the Broad Street Run, which is one of the local runs here in Philadelphia. And I said, you should maybe take a picture of yourself crossing the finish line and send it to the 2 docs that told you were going to need knee replacement surgery. Had a patient who had real bad low back pain. His daughter brought him in for, I think, the first maybe month or 6 weeks I had seen him. She used to drive him in the back of his station wagon, right? So he would lay flat on his back because he couldn't even sit in the car. We would, kind of carry and finagle him in to the office. And, it took us, again, about 6 weeks to get him to the point where he could actually sit in the car. And then by the 8th week and by the 12th week, he was driving. And then he was back. He worked on a truck. So he was back, doing that work. So we've seen quite a few miracles. The last one we'll talk about is migraines. See a lot of headache and neck patients. Worst one I had seen was headaches for 50 years. She was 10 years old when they started, and she pretty much had them. Getting to the point where almost daily they were debilitating. Many years of her life were gone just to these headaches. And the nice thing is she's still a patient, and it's been I think it's been 18 months since she's had her last headache. We did a care plan with her, about a year and a half ago. So just some of the things that I've seen and some of the things I've got to experience with chiropractic. So thanks for watching. Again, this is Dr. Frezza at the Chiropractic and Injury Center.